Previously, I discussed with you the ascending and descending tracts, where I discussed those tracts that are responsible for carrying conscious conscious sensation and unconscious sensations. In those tracts that carry conscious sensations, I made mention about 4 tracts. And in the other ones, those that carry unconscious sensation, I also made mention about 4 tracts. So for those one that carry conscious sensation, I discussed with you the lateral and anterior spinothalamic tracts. The lateral spinothalamic tract, as I told you, carries sensation for pain and temperature, which I now discussed that, and I told you that that tract carries the receptors that carry those information from our own skin or from any part of the body are what we call free nerve endings. So the free nerve endings are the ones that carry the sensation for the pain and temperature through the lateral spinothalamic tract. The other one, the anterior spinothalamic tract, which is also known as the ventral spinothalamic tract, that one carries sensation for crude touch and pressure. You know, there's a difference between fine touch and crude touch. You get my point. So we are going to discuss what is the difference between crude and the fine touch. So the structures or the receptors that carry sensation, you know, for this crude touch and pressure are what we call muscles ending in the epidermis and mesonous corpuscles in the dermis and hair end organ. These are the receptors that carry sensation for crude touch and pressure in our own body. So they carry this information, the receptors, you know, carry this sensation, and then the information passes through the anterior spinothalamic tract before it finally gets into the area 321 in the postcentral gyrus. So by and large, these are the receptors for these ones. You know, so the Gracile and cuneate tracts I've also already discussed. You know, those ones, you know, they also carry the sensation, proprioceptive sensation, you know, from our own muscles, joints, and joint capsules. And so these tracts, if you can remember, I told you that the Gracile tract, you know, carries proprioceptive information or sensation from the lower half of the body. You get it? So it is grouped medially. That is why it is on the medial side of the spinal cord. And so it carries sensation from the lower half of the body, while the cuneate tract carries sensation from the upper half of the body, including upper limb, you know, thorax, neck, and so on and so forth. And as I told you before, the head, sensation for the both temperature, pain, and what have you, and proprioception is being carried through the trigeminal nerve, which I told you before. So the Gracile and cuneate tracts, as you can see from the board, these are the sensations that they carry from our own body. Sensation of position, sense of position. What do you mean by sense of position? The sense of position, like you are sitting down now, you know which position you are in now. You are in the sitting position. I know what position I'm in now. I'm in the standing position. So for you to be aware of which position you are in at that moment, that is what we mean by sense of position. And it is this Gracile and cuneate tracts that carry this information for the sense of position. The Gracile takes this sensation from the lower half, the cuneate carries from the upper half. The other one is sense of movement. I'm just moving now. You get it? So I'm just sensing that I'm moving. The sense of movement, that is also the function of this Gracile and cuneate tracts. This is what we term as proprioception. And it is this information comes from the joint capsules. The joint capsules, they have some receptors in there. And the end organ, you know, the tendon, Golgi, what we call Golgi tendon organs in the tendons of our own muscles, they also, you know, they are the receptors that carry this information for the sense of position, sense of, you know, movement, and so on and so forth. So in the Golgi organ tendon, Golgi tendon organ is, you know, the receptor that is carrying this information. And they're also there in the joint capsule. There's also what we call tactile localization. What do you mean by this tactile localization? For example, now, if I touch you, you close your eyes and I touch you at the back, and I ask you to tell me where did I touch you, you should be able to tell me. You get my point. So that is what we mean by tactile localization. You are able to locate. Or as you are sitting down now, right now, an ant comes into your trousers and bites you. Chinaka. Won't you specifically localize the area where Chinaka bites you? You will go and localize that site. That is what we call tactile localization. You are able to localize the exact area where something has touched you. Are you clear? Then again, there's what we call tactile discrimination. If, for example, I ask you to close your eyes and I touch you in two different locations, I touch you on the neck and I touch you at the back, and I ask you to specifically tell me where and where did I touch you. That is what we mean by, tactile discrimination. That's also what we call two-point discrimination. This is also the same thing. Two-point discrimination is the same thing as tactile, discrimination, to discriminate which area and which area someone touches you. And there's also what we call stereognosis. Stereognosis is the ability of an individual to appreciate an object while his or her own eyes are closed. For example, close your eyes. Can somebody close, Muhammad? Close your eyes, don't open. Open your hands. I say don't open. Open your hands like this. I will give you something, then you should be able to tell me, what I give you. Are you clear? Don't open, pa. So, supposing now I give Muhammad this. Have you seen what I am going to give you? Yes. Okay, Muhammad, what did I give you?
It's like a paper.
This guy is sick. Okay. My friend, close your eyes. This guy is going to close his eyes. This guy is going to close. Keep quiet. This guy is going to close his eyes. I'm going to give him something. Okay. Don't open. Don't open. Have you seen what I'm going to give you? Yes. You've seen it? Yes. I'm sure the guy have not seen it. Okay, what did I give you?
Something like eyeglass?
Yes. That is what we call stereognosis. So stereognosis is the ability of an individual to appreciate or understand an object in his own hand while his eyes are closed. But the opposite of this, that is what we call astereognosis. You put an A in front, behind it. That is inability of an individual to appreciate. Muhammad, you hear my voice? So, but actually, the fault is not from Muhammad. It was from me. I was supposed to tell him to touch it. His palms were wide open. I just placed it on him. This guy was smarter because he closed it and touched it. That was the difference. So if you close your eyes, you touch anything, you give anything, you appreciate it, that is what we mean by, yes. So the opposite is what we call astereognosis. There are conditions whereby you have certain diseases while somebody has this disease, astereognosis. So there's also vibration sense. I'm sure you know what is vibration. You know your handsets, you put it on vibration. Somebody calls you, you will feel the vibration in your own, body. That is vibration. So they are all being carried through these two tracts. And I already discussed the two-point discrimination. Then the sensation of the pressure. Pressure, we have pressure in the atmosphere. We have blood pressure. We have internal body pressure and so on and so forth. All this pressure and what have you, either from external pressure or from the internal pressure, all these have been sensed by these two tracts. As I told you before, trigeminal nerve is the one that carries all those sensations in the head, be it pain, temperature, crude touch, pressure, all this sense of position, sense of discrimination, sense of tactile, whatever, they have all been carried by this trigeminal nerve. So we have seen this. So this is just the tracts. Now, I've already discussed those tracts. I'm not going to discuss, the first order, second order, because I discussed those ones before with you. So this is just the 3D, slide for the Gracile tracts and what have you. So today I'm going to discuss other ascending pathways. So if you can remember, the other ascending pathways are those ones that carry unconscious proprioception. I've already discussed the anterior and posterior spinocerebellar tracts that carry unconscious proprioceptive information from our own body. Those are the two tracts that I discussed with you for the unconscious proprioception. The other two are the spinotectal and spino-olivary tracts. So by so doing, we have now completed the 4 tracts that carry unconscious proprioception. So we have 4 tracts carrying conscious sensation, that is anterior and posterior spinothalamic, plus gracile and cuneate tracts, that is for conscious sensation. The tracts for the unconscious sensation are the anterior and posterior spinocerebellar, then spinotectal and spino-olivary. I've already discussed the spinocerebellar, the anterior and posterior with you. So the other ones that I'm going to discuss with you today are these two, the spinotectal tract. The spinotectal, if you can remember, in those tracts that I've discussed, there are those that were crossed. For example, if you can remember your, anterior lateral spinothalamic tracts, they cross to the opposite side, right? So even this one now, if you can remember also, the ventral spinocerebellar also cross to the opposite side, but then finally it crosses back to the same side in the cerebellum. Can you remember that? Fine. So even this spinotectal tract is a cross kind of tract. Reason because it, the first order neuron, as you all know, for all this sensation begins from the dorsal root ganglion. That is what we refer to as DRG. Dorsal root ganglion. The DRG, you see abbreviation there as DRG. The second order neuron begins from the posterior horn. In the posterior horn, you can remember your 4 various nuclei. You get my point. But then there are certain tracts that unfortunately scientists or the neuroanatomists are not able to delineate the neurons by which other tracts take origin. So the second order neuron is unknown. You get my point? So that means, there are other nuclei in the posterior horn that are not known by the neuroanatomist. But other tracts, their own second order neuron are shown when you do the sections and then you stain, you will see where they begin. But there are those tracts that they pass through the posterior horn, but then unfortunately the nuclei are not being able to appreciate them. Probably maybe the staining, materials, we are yet to find those ones that can identify the second order neuron in there. So nobody can tell you whether they pass through, the substantia gelatinosa, or from the nucleus proprius, or from the Clark's nucleus, or from the visceral nucleus. Are you clear? That is why you see that this spinotectal tract, the second order neuron, is unknown. But in other texts, or some authors believe that the second order neuron begins from nucleus proprius. Are you clear? So it's like there are these two, contemplations. The nucleus is either not known or known. That means if it is unknown, that means it passes through the posterior horn, second order neuron, nobody knows it. So it passes out from the posterior horn and then ascends up to the opposite side. For those that believe that it passes through the nucleus proprius, from there the second order neuron begins and then get out of the posterior horn, and then it passes into the anterolateral white column of the spinal cord. And after passing through the medulla oblongata and forms the synapse, in the superior colliculus of the midbrain. If you can remember, I said that the midbrain now is divided into posterior part and anterior part. The anterior part is what we call the tegmentum. The posterior part is what we call tectum. So in the posterior part, there are swellings, what we call bodies, corpora. We have 2 above, 2 below, what we call superior and inferior colliculi. You get it? So those are swellings of nuclei. So the 2 nuclei above are what we call the superior colliculi. Those one below are what we call inferior colliculi. The 4 together, they are called corpora quadrigemina. Corpora means body in Latin. Quadri means 4 in Latin. So corpora quadrigemina, 4 bodies. 2 superior, 2 inferior, making 4. So we have 2 pairs. So the spinotectal tract ends in the tectum. So the first order neuron begins from where? Dorsal root ganglion. The second order neuron is unknown or is known to pass through the nucleus proprius before it finally crosses out to the anterior lateral part of the spinal cord before it finally ascends up. It passes up through the spinal cord to the medulla oblongata, to the pons, and then finally it reaches the superior colliculi. That is the second order neuron. So what is the function for this spinotectal tract? The function for this spinotectal tract is like as you are sitting down here. If, let's say, I'm just going behind this guy, don't turn. I'm going behind this guy. Then suddenly, I now prick this guy with a needle. The guy will suddenly move and look at me and see what is going on, right? So the guy reflexively will turn his gaze, that is his eyes, and his head towards the source of the stimulus for him to see what is going on. That is what we call spino-visual reflex because of tactile stimulus or painful stimulus. You get my point? Either I touch him, it's just like you are going, you are just moving. One nice girl just pinch you by the side. You will just look at the side and see who is she. Are you clear? Reflexively. So that is what we call spino-visual reflex. It is responsible for, someone, to involuntarily turns his eyes and head towards the visual stimulus. Are you clear? So now this is the function of the spinotectal tract. The other one I've already made mention this is the function of the tract. And so you can see the first order neuron, which is this one. It is this one in blue here. So the first order neuron, you can see it, dorsal root. And then the second order neuron crosses to the opposite side and then passes upward into the superior colliculi in the midbrain. So the other one is what we call the spino-olivary tract. The spino-olivary tract is also crossed. It's also what? It's also crossed. So now the first order neuron is similar to that of the spinotectal because it also begins in the dorsal root ganglion. And its own second order neuron is also not known. You get it? So the scientists up to today don't really know the second order neuron. Or they cannot delineate which of these nuclei in the posterior horn this tract begins. That is why we say the second order neuron is not known where it begins. But then we know that there is a second order neuron there, but it's not known. So it now crosses to the opposite side before it finally ascends up. The second order, it now ends into the inferior olivary nucleus. If you can remember, I discussed with you in the lower part of the medulla oblongata. That's what we call inferior olivary nuclear complex. The inferior olivary nuclear complex is a very large nucleus that is lying in the lower part of the medulla. I will discuss the brainstem with you, I told you before. So now therein, the second order neuron terminates there. And the third order neuron now begins, crosses to the opposite side, and goes into the cerebellum. So this tract ends in the cerebellum. And this one is responsible for conveying information to the cerebellum from the cutaneous and proprioceptive organs. So this one is responsible for carrying out proprioceptive information and control of our movement unconsciously. Are you clear? So that is the function of the spino-olivary. So while the spinotectal tract has two order neurons, first order neuron from the dorsal root ganglion, second order neuron ends in the superior colliculi. But this one, we have the first order neuron in the dorsal root ganglion, second order neuron gets out of the posterior horn, and then it terminates in the inferior olivary nucleus, and from there the third order neuron crosses to the opposite side, and then goes to the cerebellum of that side. So it's like there is double decussation. The first one crosses to the opposite side, ascend up, then goes to the inferior olivary nucleus of that opposite side. From there now, third order neuron crosses to the opposite side to return to its own right side, if it is the right side where it began. Are you clear? So once you have double decussation, that means the crisscrossing is cancelled. I don't know whether you understand. It's cancelled. So that means left controls the left, right controls the right. That is the meaning of double. Yes, so we have seen this. So these are the tracts, for these, remaining tracts that are responsible for the unconscious sensation in our own body. That is the pathway for the spino-olivary tract. So this is the first order neuron, and the second order neuron in green. Then the third order neuron goes to the cerebellum of the opposite side. It's supposed to be spino-olivocerebellar tract, ideally. Are you clear? It's supposed to be what? Spino-olivocerebellar, because it has 3 order of neurons. But then actually it's shortened to spino-olivary. But then we know that the third order neuron began from the inferior olivary, then to the cerebellum. Yes. So we have seen that. So other tracts that we are going to discuss, I don't think we'll be able to discuss this because we are going to discuss motor pathways.